All right, I'm back for question number 1, which I led up to by showing the Louisiana data. What's going on with Louisiana's second wave? Because Washington is definitely past the first wave, and so one of the things we want to know looking forward is what's going to happen with a second wave. Could the second wave be worse than the first? Well, we have one state where we have a clear first wave, second wave pattern, and that's Louisiana. They had an outbreak in New Orleans early on. They had an outbreak in the rest of the state, and again, this is statewide reporting. My question was, okay, I know the first outbreak was in New Orleans. Was the second outbreak just as bad in New Orleans? Or was it better? The answer is it was better. The rest of the second wave happened in the counties outside New Orleans. And it seems that New Orleans, after getting hit hard the first time, was spared the same brunt of the epidemic the second time. This is really good news because it means if this can be generalized to most places that have seen an intense first wave, that means the second wave, if it exists, will be less intense in the same place. And looking at data on the state-by-state level can be appropriate, but even for a small state like Louisiana, it means that there's heterogeneity. There are differences among the places in Louisiana. So let me show you, this isn't I wanted to do this, and actually, I've been thinking about it. I raised this question on earlier podcasts, but I didn't have time to do it. I have a day job where I have to work with proteins and antibodies binding stuff and, other projects like my T-cell project that I'm working on right now. All that is to say, I didn't get around to this. I was very happy to open up my Twitter today and see that the data scientist who runs the model that I trust the most for predicting what's going to happen for COVID, he noticed the same kind of things were happening in that COVID seemed to be hitting some kind of wall, in hospitalizations at least, and coming down in several of these states. And so he wanted to ask this exact same question. He wanted to break it down by parishes, because that's what they have in Louisiana, instead of counties. And if you break it down by the counties, Orleans and Jefferson are the two counties that encountered where New Orleans is, and you have the big spike that you see in yellow and in blue on the left side of this graph, that spike in cases that happened in April. Follow it through to July on the right side of the graph, and you look at that, the highest line in April, blue, was the lowest line in cases per capita in July. The second highest line was the third lowest line. And so you see that you have this inverse relationship. The harder a parish was hit the first time around in April, the less hard they are hit, again, per capita, but that's what really matters here because that accounts for things like density and things like that. If you look at it by deaths, you see the same pattern, even more distinct, because now the blue and yellow lines that were around New Orleans, that were definitely the highest, it wasn't as big as New York, but it was a definite scary outbreak in April. And they didn't really have an increase in deaths that you can see in this at all in July. They're the two lowest lines. And so what you have is you have cases where there is a second wave, but is it really a second wave if it's not hitting the same part twice? It's hitting different parishes, and I believe that if we chart county by county, as long as we have a good measure of what an area is, then we will see this same kind of pattern overall. I'm assuming it's generalizable. This data looks solid enough that I believe it is generalizable. Another way to look at it is, instead of saying highest, lowest line, let's be more mathematical about it, and let's actually plot the lines in terms of deaths before June 1 and deaths after June 1 for these different parishes. And honestly, this makes a straight line. You could fit this to a regression curve, and the R value, R squared, would actually be, in my opinion, for this kind of data, it would be very decent. You can see that if you have fewer total deaths, you're on this side of the graph, the left side of the graph, you're on the top of the graph. If you're on the right side of the graph, you have more deaths before June 1. Then you're on the bottom side of the graph, you have fewer deaths after June 1. Again, there's lots of vigarities between parishes to parishes. This is real-life data. This is going to be kind of messy. This is a lot less messy than I expected for something that is this simple. it does seem that the more deaths you have before June 1, the fewer ones you'll have after for the state of Louisiana. This is Gu's own talk about it. His model estimates that 20% of people have been infected. And so part of the heterogeneity is that you have enough people who've already been infected that have immunity to the virus that, I don't know if they could even get infected again, but even if they do, they will have milder symptoms. They'll be at much less risk of dying from this. That's the way immunity works. The virus presents itself to the immune system. The immune system learns what the virus looks like and doesn't let it get away with the same trick twice. Fool me once, shame on you. Fool me twice, shame on me. Your immunity has the same kind of thing going on. And it looks like enough people saw the virus in New Orleans that it's running into a sort of wall where there is some sort of immunity. Cross-reactivity could play a role as well. We can't even say where this comes from. The other thing that plays a role, how many people are wearing masks? How many people are socially distancing? You bring down the severity of the virus socially by the way that you act. I don't want to minimize that at all, but I also don't want to maximize it. Okay? Wearing a mask and socially distancing is one part of a complex equation, and we can't give ourselves all the credit for bringing this virus down. I know firsthand that the immune system has a role to play, and we don't know how significant it is. But we've also got to know that we don't know, and not pat ourselves on the back if the virus goes away and say it's all our fault and take pride in it, or blame people if the virus comes to some other state that has maybe some people we don't like in it, and say that it's because you didn't mask up that this is coming to you. That's probably at least 30% true, but I'm not happy with 30% true. I want to be all true, and I want to account for everything that will affect this virus. And that's exactly what Gu's saying right here. You can go to his Twitter account. I recommend that you read the whole thread. And so looking region by region, hospitalizations are declining in the South, in the Sun Belt, where we had all these problem states before. They're going down now. And I went through the different regions on this public tool that I've shown you before, this Tableau tool. And the only one that I've seen where hospitalizations are actually going up as a region is the Midwest. And you see that they're going up at a lesser rate than they went up before. If we want to find more evidence of first wave, second wave dynamics, I suggest we look at the Midwest. In fact, I think Ohio might be experiencing two waves in the same way that Louisiana did. Not as intensely, maybe the pattern won't be as easy to find, but I believe the pattern will be there. And if this is the worst increase that I can find nationwide, I will take that as good news relative to what I've been seeing for the last month or so. I'll take that as good news any day of the week. So hospitalizations are declining in every region but the Midwest. And note that they're declining in California, Arizona, Texas, and Florida. Those states don't have much in common in their approach to this. California has very distinct blue state policies. The other ones have very distinct red state policies. And I think that those policies do have an effect, but they're not the only thing having an effect. That's the important thing to see. If we're all in the same boat together, we're all in the same boat as far as this decline goes as well. And so top-down policies are one piece of the puzzle. Like I said, I think they're probably a third of the puzzle, but maybe not even most of it. Bottom-up policies of how do people act when they see this virus coming and they see how bad it is. Without whatever the governor says, people are going to act a certain way when they know someone who has it or when they hear the stories. That's a good thing, because that's part of how we fight this virus socially. And then there's the natural heterogeneities in how people space themselves apart, the people they go to visit, socially distance, and also the immunity that people have. The potential for cross-reactive immunity should not be minimized. Again, it's a research project of mine, and I see it. It's there. How much is it? 25, 30, 35%. I'd be happy with that. And so let's find out. We have these pieces to the puzzle. Mask wearing is an important piece, but it's only one piece as mandated. So if you want to do a bottom-up policy, wear a mask yourself. Encourage others to do the same. That's what I'm doing. And in fact, I have a later question about this. When we're talking about outbreaks, of course, everyone knows the outbreaks in the Northeast. I talked about the outbreaks in New Orleans. There also was an outbreak in Michigan. And there's even better news. So far, there hasn't been any sign of a second wave in Michigan. Their hospital data is a little weird in the way that it curves up and down. It's a little blocky. But, I trust it as far as it goes. And it looks like in that data, if anything, there's a slight bump in hospitalizations up. So that's a good news. That's more evidence that if you get hit hard the first time, it's harder for you to get hit hard a second time. Louisiana is the poster child for this. And so that's my first question. Now I want to turn to other questions that people have asked.